The Women's Wellness Center in Los Alamitos is a center specialized in the care of women of all ages who have sexual problems and also women dealing with menopausal issues. As the center's medical director, Dr. Susan Sklar, tells us, improving a woman's sexual function will have positive impact on all aspects of her life.
I would say probably 75 to 80% of the women I ask, are you having any sexual problems, say yes. It's actually unusual for someone to say, no, everything's fine. And if it's not their own sexual problems, it's difficulty in their husband's functioning or their partner's functioning, or marital and relationship difficulties. Treating women with sexual problems presents a number of difficulties. First of all, this is a relatively new field of endeavor. Secondly, there are no Food and Drug Administration approved treatments for women for sexual dysfunction. What happened in terms of women's sexual health is that there was very little focus on it until Viagra came out. And with men's improved sexual functioning, women needed to be in shape. And so I think that was really the stimulus for interest in women's sexual health. But I can tell you women get discounted. Women are left in the dust. And when women bring issues up to doctors, to a large extent, they're told that this is a normal part of aging, we can't do anything about it, don't worry about it. And they're very important issues to women are discounted by the medical system. In terms of medical treatment, we use what we call cutting edge, meaning things that are not Food and Drug Administration approved, but for which we have evidence and studies of effectiveness. And it includes using some of the antidepressant, anti-anxiety medications, using hormonal treatment with estrogen and testosterone, and also DHEA, which is a testosterone prohormone, as well as devices that improve blood flow. And then, of course, there's always the psychological element that affects women tremendously, and so we use sex therapy or psychological evaluation and counseling. There are a variety of herbal and non-Western medicine treatments for sexual dysfunction, and acupuncture, in fact, has a whole field of women's sexual dysfunction treatment with acupuncture and herbs. Our center is called the Women's Wellness Center, and we have a team assembled to really promote not only sexual wellness, but wellness in general, because that impacts women's sexual functioning and vice versa. So on our team is a sex therapist, who is a psychologist who specialized in areas of sexual functioning and relationship issues, a gynecologist, who is myself, a physician assistant who is specialized in the area of women's sexual functioning, an acupuncturist who has a specialty area in women's health, and a nutritionist as well as an exercise physiologist. So we have all of these assembled in one place, as well as instrumentation for testing neurological and vascular flow to the genital area to help in our assessment. And by having all of these components on site, we feel like we can handle the vast majority, 99+% of problems that women come in with. One patient whom I treated recently, who's 52 years old, and she's been menopausal, no menstrual periods for about a year, and came in and said that her interest in sex and arousal when she thought about sex had really completely gone away. And as a result, she and her husband hadn't had sexual relations in months. She's a fairly typical patient of menopausal and perimenopausal women. By replacing her testosterone and DHEA, which is a testosterone prohormone, and also using vaginal estrogen to renew the vaginal linings, she found that her sexual desire and functioning were back to what they had been. So she's a happy camper.